Good evening, everyone. My name is Cindy George. I'm a veteran health journalist and a proud member of the National Association of Black Journalists. And I want to welcome everyone to today's panel, Reducing Stroke and Dementia in Black Americans, New Research and Stories. On behalf of the NABJ and the National Institute of Neurological Disorders and Stroke, NINDS, one of the 27 institutes and centers of the National Institutes of Health, we'd like to thank you for joining us this evening. This topic is very important and deeply felt in our community. NABJ is proud to partner with NINDS on this webinar, given our shared commitment to improving the health and well-being of Black Americans. This evening's discussion is one in which you'll learn about an important health issue that affects Black men: high blood pressure, which, if left unmanaged, can lead to stroke, heart disease, and dementia later in life. And Black men in particular are at greater risk of having these conditions. Today, you'll hear from 3 panelists who will share more information about the link between high blood pressure, stroke, and dementia, risk factors for Black men, and personal experiences. Panelists will also share actionable steps and helpful resources from the NINDS Mind Your Risks campaign you can take away from this session to stay healthy for you and your audiences. There will also be plenty of time at the end for you to ask the panelists questions, and we'd like you to use the Q&A box to post those questions rather than asking in the chat box. So, without further delay, let me introduce our panelists. First, Dr. Richard Benson. Dr. Benson is Director of the Office of Global Health and Health Disparities at the National Institute of Neurological Disorders and Stroke. He is a leader in the field of vascular neurology and health disparities research. His areas of research interest and expertise include health disparities and health equity research, as well as minority, community, and global health. Our next panelists are Brady Johnson, a stroke survivor and ambassador for the American Stroke Association, and Jonah Francis, Alzheimer's Association Connecticut chapter board member, volunteer community educator, and a certified dementia practitioner. They are joining us today to share their own personal health stories with you. Brady is a dynamic and highly motivated professional who spent 13 years in the military in the U.S. Air Force, serving his country. He also worked at the Social Security Administration before he retired and is a published author. Now, Brady competes in natural bodybuilding. Bodybuilding helps him take care of his body and mind. Currently, he resides in Belvidere, Illinois, with his wife and 2 sons. Jonah is an active board member for the Alzheimer's Association, vice chairman for the Home Care Association of America in Connecticut, and owner of Pansy Home Care Service and a mental health organization, A Better Way. He was also recently recognized as a 40 Under 40 honoree by the Hartford Business Journal and 100 Men of Color honoree. Just a reminder, please use the Q&A box to post your questions rather than asking in the chat. Before we take off, we have a poll question for our audience. Do you have a friend or family member who has experienced stroke, dementia, or other brain health conditions? We'll give you a few seconds to respond. Let's see the results. Wow, this is very telling. We're in the right place and at the right time to learn more about the connections between these between these health conditions. So let's get started. First, we will have a presentation from Dr. Richard Benson of NINDS. I trust you're having a wonderful day and that you're ready, Dr. Benson.
Yes, I am. And thank you for that really warm introduction, Cindy. It's truly a pleasure to be here with you and the other panelists, and I really look forward to our discussion at the end. Next slide.
Yes, Dr. Benson. There is extensive research exploring the link between high blood pressure, stroke, and dementia. And NINDS recently launched strategic initiatives to advance equitable health practices in this space. Please take us through your presentation to share some of the background of this topic with our viewers.
Sure, I'm happy to do that. So if you can see from this slide, heart disease and stroke are the first and the fifth leading causes of death in the United States, and they actually are two areas of health disparities. Today, we're going to focus on stroke and the connection between stroke, uncontrolled hypertension, and dementia. Every year, there are about 700,000 Americans who actually suffer a stroke. That's about every 45 seconds, someone in the United States has a stroke. And it's a major area of health disparities. Stroke is 2 times more common in African Americans compared to white Americans. And it's 1.5 times more common in Hispanic Americans compared to white Americans. Next slide. I show you here an MRI of what happens when a person has a stroke. On this MRI, we have a slice of the brain, and that white area that you see is actually an area of damaged tissue in the brain on the left side of the brain. This is a major stroke and can be incompatible with death or leave someone with severe disability. This type of stroke can cause inability to speak as well as weakness on the right side of the body. Next to that, we have an MRA that shows a cutoff of a major blood vessel in the brain. Currently, we have treatments. If you get to the hospital quickly, we can give medication to break up clots that may be blocking that particular blood vessel. Or we can also do an embolectomy procedure where we go up into that artery in the brain and we can remove the clots that are in that area. And this is the cutoff here on the left MCA artery. Next slide. On this particular diagram, we have 2 various images of the brain. One of the images shows those little small black dots. Those are small microhemorrhages in the brain. Those occur, if we see a lot of those in people, it could be a sign that a person has a particular type of disease that leads to memory loss. And also on the CT scan, we actually have a really large hemorrhage there that is another form of stroke that can also lead to memory loss, loss of various functions as well. By far, the first stroke that I showed, the ischemic stroke, the blockage of the blood vessel, is the most common type of stroke that we see. That's about 87% of all strokes. And the other 13% is related to hemorrhages in the brain. Next slide. A stroke occurs very suddenly. So anytime we think in terms of stroke, we think of the sudden onset of these symptoms that we have listed here. So it's the sudden onset of weakness on one side of the body that was not there before. So it's a sudden onset of new weakness on one side of the body, and usually it's on the same side of the body. Sudden onset of difficulty walking, difficulty seeing out of one or both eyes, and difficulty speaking. That could be an inability to get words out, or just very slurred or mumbled speech, or incorrect speech. All of those, the sudden onset of any of those could be a stroke, as well as the sudden onset of a severe headache, like the worst headache you've ever had in your life. These are the warning signs for a stroke. Next slide. We divide the risk factors for stroke into those that are non-modifiable, meaning those that we can't change or do anything about, and those that are modifiable. Luckily, the list of non-modifiable risk factors for stroke, those that we can't do anything about, they're very small. Age is one. Above the age of 65, your risk of stroke will go up about 1% every year. However, young people have strokes as well, but by far, age is a risk factor for stroke. Strokes are more common in men compared to women. However, because women tend to live longer than men, if we looked at any point in time in society and to try to find people with strokes, there'd be more women living in society with strokes than men. And then race and ethnicity are also risk factors. I talked earlier about the fact that stroke is 2 times more common in African Americans compared to whites, and it's 1.5 times more common in Hispanics compared to whites. We're learning more about the disparities in other race and ethnic groups in this country. But that's the list of risk factors that are not modifiable and that we can't change. But those that we can change, it's a much longer list. And by far, uncontrolled hypertension is the #1 modifiable risk factor for stroke. It's highly associated with stroke and it's very prevalent. 1 in 3 adult Americans actually has high blood pressure. And of those, only half of them actually have their blood pressure under good control. And I have listed the other modifiable risk factors for stroke: diabetes, high cholesterol, being overweight or obese, decreased physical activity, smoking and drug use, and also your socioeconomic status. And hopefully we can talk about this later. But people with lower levels of education, lower income, for various reasons, have a higher risk of stroke and stroke mortality. Next slide. Now, uncontrolled hypertension has an impact on various organs in the body. It can impact obviously the brain, and we're going to talk about this a little bit more, causing both ischemic strokes as well as hemorrhagic strokes in the brain and other damages that I'm going to talk about shortly. But high blood pressure can also cause narrowing of the arteries in the neck. It can also impact the heart. It can cause a dilated heart and block the arteries in the heart, and this is what leads to heart attacks. It can also impact the kidneys, leading to kidney failure, as well as impacting the reproductive organs, particularly in men, leading to sexual dysfunction. And also it can block the arteries in the legs, causing pain in the legs when a person walks. And also it can lead to amputation of the legs because of the blockage of those blood vessels. And so high blood pressure actually affects multiple organs in the body. Next slide. Now, in addition to all of those things that we talked about, there's new research that has shown that uncontrolled high blood pressure also leads to cognitive impairment and potentially dementia later in life. Now, just to talk a little bit about dementia, dementia is sort of an umbrella term that encompasses multiple diseases. And with dementia, you have a loss of memory and cognitive function, as well as other, what we call it, higher level executive functions, like your reasoning, your ability to control your emotions, your ability to do multiple step commands. That's what dementia is. The most common form of dementia that most people have heard of is Alzheimer's disease. Alzheimer's disease is a specific disease where we see certain pathological findings in the brain. What that means is that you have to take the brain and after someone dies, and you cut the brain into slices, and you can see plaques and tangles inside of the brain. And that's how we diagnose Alzheimer's disease. There's some other higher level imaging tests that we can do as well to diagnose Alzheimer's disease, but that's a specific form of dementia. Some of the other forms that people may not have heard about is vascular dementia, and that's due to uncontrolled high blood pressure. There's multi-infarct dementia just from having multiple strokes that can also lead to dementia. There's some neurodegenerative disorders called Lewy body disease and frontal temporal dementia, which also are other forms of dementia. And there's one other form of dementia now that we talked about. It's called mixed etiology dementia. And that's when you have a combination of one or more of these various forms of dementia that I have listed here. And this is actually a major form of dementia. Most people will have vascular pathology, possibly multiple strokes, and some Alzheimer's disease as well found in their brain. And so by far, mixed etiology dementia is now a leading cause of dementia. Next slide. When we think about dementia, it's on a spectrum. We have sort of the normal, cognitively unimpaired person, and you can see this on this chevron diagram all the way over to the left. And as you move towards the right on this diagram, we see a higher increasing amount of cognitive impairment and dementia. Each person has to go through, if along this continuum to severe dementia, there's something called mild cognitive impairment. What we'd like to do is catch people at that stage of mild cognitive impairment before they develop dementia and try to stop a person from progressing. That's why it's important to know these modifiable risk factors and intervene and do things at that particular time. Next slide. Dementia also is a major disparity. We know that more women suffer from dementia than men, and possibly due to the fact that women live longer. I mentioned that earlier. But also there's a race ethnic disparity in terms of Blacks and Hispanics. If we look at people in society as they age, we see more Blacks and Hispanics who actually suffer from dementia than whites. Interestingly, as well, hopefully, if we have time, we can talk about this. We don't have people of color, race and ethnic groups participating in clinical trials. And so this is not good because there are new medications that are coming out to treat dementia. And if we don't have people of color participating in these trials, we don't have the information to know that they will be as effective in these groups. Next slide. So here on this diagram, I just show the changes. So I talked about strokes, ischemic strokes or blockage of blood vessels and hemorrhagic strokes, but just having uncontrolled high blood pressure, it actually leads to damage in the brain. And that white fluffy area that you see around those dark spaces in the brain, those kinds of changes occur from uncontrolled hypertension. And when you see people with that very severe or that more significant amount of white puffy material around those spaces in the brain, those people tend to have the dementia that we talked about. Next slide. Now, just a little bit about blood pressure. The normal blood pressure should be less than 120/80. The top number is called your systolic number, and that's the pressure within your vascular system when the heart is contracting. And the lower number, or the diastolic number, should be less than 80. And that's the number, that's the pressure in your blood vessels when the heart is relaxing. If it's above that, if it's 120, not 120 to 129 systolic, then you have an elevated blood pressure. Some people think that that's okay, but that's elevated. If it's greater than 80, then it's elevated. If you get in a blood pressure range of 130 to 139 over 80 to 89, then that's stage 1 high blood pressure. These are newer blood pressure numbers that's very important to consider and monitor this. And this is based upon the SPRINT study, which is a study that was funded by the NIH. And this study found that people that have lower blood pressures have lower rates of having cognitive impairment or memory loss or dementia later in life. Next slide. Based on this information, the NINDS, and again, we're really happy to partner with the NABJ and have this webinar today. We created this campaign called the Mind Your Risk campaign, and it's geared towards African-American men because African-American men have the highest rates of uncontrolled hypertension in the United States. And as I mentioned, if you have this uncontrolled hypertension chronically, it can lead to all of those damages that I talked about. So this particular campaign is geared towards African-American men in what we call midlife. And that's between the ages of 28 to 45. Because if your blood pressure is uncontrolled at this age, you have a longer period of time of developing those complications that we've talked about. You can go to this web address listed on the slide to get more information about the campaign. Next slide. We actually have created an informational video to develop self-efficacy in people in order to, African-American men in particular, to get them to want to take charge of their health and to try to control their blood pressure and lower the risk of stroke and dementia. So we're going to play the video here, and then I think after that, I'm going to hand it back over to you, Cindy.
I'ma shine again. I'ma do some things I never did. Live a life that I'm supposed to live. Wake up as the sun is rising and give thanks again. This summer is a new day dawning. Hold on, it's a new day coming.
Back to you, Cindy.
Thank you so much, Dr. Benson, for sharing details about this eye-opening connection between high blood pressure, stroke, and dementia. You know, this is a very timely conversation, given that the World Stroke Day observance was just last weekend, October 29th. So let me ask you a few follow-up questions. In your presentation, one statistic you mentioned was that someone has a stroke every 45 seconds and dies every 3 minutes. Do you find most people are informed about the risks or believe they are untouchable, that this couldn't happen to them?
That's an interesting question. I think there are a lot of people who don't think that it can happen to them. There are people who know the warning signs of stroke, but they don't think that it can happen to them. And so if they have the symptoms, they ignore them or they wait. They stay at home and they wait till someone gets home that they can talk to and ask them if this is really something I should be concerned about, or they call their neighbors, or they just continue because they have competing needs. A lot of people, most people are working people, they have families, people that they're trying to take care of, and their health, unfortunately, is not a top priority. So there are some people that ignore it because it's not important and they don't want it to happen. Others are not aware of it. And so it's unfortunate. And it's unfortunately people who fall into those populations that are at higher risk that don't think about or don't have time to be concerned about their risk of stroke.
So what is the missing piece of the puzzle that can help prevent stroke?
The missing piece is sort of understanding your risk. There are certain things like your family history and your gender and age that you can't change. However, the missing piece is sort of taking charge of your health, understanding that stroke is preventable, that if we control our risk factors, our blood pressure, our blood sugar, our cholesterol, exercise, we should get 20 to 30 minutes of exercise a day, at least 3 times a week at a minimum. And those 20 or 30 minutes can be in 10-minute increments. But exercising, have a healthy diet with 5 to 7 servings of fruits and vegetables per day. That's also helpful, as well as not being overweight or obese. And physical activity is an independent risk factor. If you are overweight and you exercise, your risk of stroke is going to be lower than someone else of the same weight that does not exercise. So I'd like to separate those when I talk about your level of physical activity and your weight. So it's important just to be physically active regardless of your weight. Getting enough sleep at night, as well as taking the medications that's prescribed to you, and being tied into a good medical provider. And that could be a nurse practitioner, it could be a physician, it could be some other allied health professional, but being connected and knowing what you need to do to take care of your health.
And so that messaging about controlling your blood pressure in your younger years as an investment in your future is so very important. One other thing I learned tonight was about the heart-brain connection to dementia and how we just really don't realize that there's a link there often. So is there anything you'd like to share additionally about how high blood pressure can lead to dementia?
No, that's a great point. Yeah, and research wise, we're also learning more about that connection. We've known historically the risk factors for cardiovascular disease, and they're very similar to, which is heart disease, very similar to the risk factors for stroke as well. So we've talked about heart health for a long time. Now we're also focusing on brain health. And so it's important to do healthy things for your brain. And if you are doing healthy things for your brain, you're also protecting your heart. So again, all of those risk factors that we've talked about, the physical activity, the blood pressure control, the good diet, getting your blood sugars under control, but also doing exercises to exercise your mental activities and your mental acuity. So it's important as well as we age to read more, to do puzzles, to communicate with people. If you have hearing aids, it's important to wear them so that you can hear. People that have hearing loss that don't wear their hearing aids actually have a higher chance of going on and developing dementia because they stop interacting with people in conversations. So brain health is very important as well as heart health in order to decrease your chance of having a stroke, a heart attack, or develop dementia later in life.
Thank you for sharing that additional background, Dr. Benson. Now let's transition to the second half of our conversation. We will be joined by Brady Johnson and Jonah Francis. So Brady and Jonah, we're so grateful to have both of you here today to share your personal experiences with stroke and dementia. We want to hear a bit about your stories and why this topic is so important to both of you. Brady, let's hear from you first, and then Jonah.
Well, good evening. I was always an athlete as a young child. Played baseball, football, and I played college baseball. And after college, I joined the United States Air Force. And at that point, I had been running marathons and thought that I had everything on top. I was in shape. But I had some of the things that Dr. Benson was speaking about that at that point, I did not realize I was part of it. I had a lot of stress. I had a divorce. We had Afghanistan going on. I'd also been in a terroristic bombing. So I wanted to give all I could, but of course, I wasn't in a hurry to want to get involved. I was living alone. And I didn't have a doctor because I'd been transferred to the state of Illinois from another state. So unfortunately, I was basically talking to myself about what these things could be. And I had been having a headache for about 3.5 months, about 3 months. And I thought it was just stress. People around me, whenever I talked to them, they said, "You're just having stress headaches. That's all it is, Brady. You'll be okay." Well, one day I walked past the doctor's office on base and told the doctor I needed something stronger than Tylenol. And he asked me to give him some of the symptoms. And I told him, my ears have been popped for about 3 weeks. I've been having a headache every day for 3 months. And he sent me off base. And in the emergency room after an MRI, in my uniform, the doctor said, "How do we say this militarily? Houston, we have a problem." He said, "You have been bleeding for 3 months. And we don't understand how you're still alive, as a matter of fact, because you run every day." I'd run 6 miles that morning. And they took me into surgery. And immediately in surgery, I had a massive stroke. And it was hypertension. I did not know my blood, I didn't know that I had extremely high blood right now. I didn't know. I thought I was in shape. I thought that there was no problem with my, with anything. But all of the things going on had caused this. And I had aphasia post-stroke. I couldn't speak. I was told I'd never be able to walk again without aid. I was told that I would never get the opportunity to drive again because my eyes had crossed during surgery. I was told that with 43 medicines, I would never be able to make children. And they told me that I was never going to work ever again. And I realized that at 31 years old, I had gotten somewhere because I did not take those steps that I should have.
Wow. And Jonah, tell us a bit about your story.
Wow. First of all, Brady, thank you so much for sharing. Wow. What a story. My story is also personal. It started back with my grandmother. My grandmother was diagnosed with dementia. We are Jamaican, so she was living in Jamaica at the time and was brought up to the United States by my family. My father and my mother is my father's mom. And the mission was to have her age up here in America with us. At the time, I was still living at home with my parents. And I remember coming home, all of us coming home from work, not knowing where grandma was. And, you know, she had wandered out in the dead of winter, just a nightgown on, no shoes on. Again, it's the dead of winter. Found her down the street. And where things really got difficult was when we brought her back into the home, and she was really mad, was yelling. And I remember like it was yesterday, you know, the yelling and her anger wasn't what, you know, triggered my father. It was the fact that his mom, you know, someone that he'd been taking care of his entire life, had no clue who he was and wanted to stay away from him. So for me, it was definitely personal. But fast forward to today, my grandmother always used to say, like, you know, life's a series of uncoincidental coincidences. So my mom started a home care agency. It was not because of the experience with my grandmother. My mom was a CNA for 32 years, and I joined her on that journey. And every single day, we solely take care of people that are diagnosed and living with dementia. So we're in the fight every single day with people that are living in and living with dementia on a regular basis. But, you know, thirdly, I do have a 1-year-old son, right? And as Dr. Benson shared, Black people are 2 times more likely to be diagnosed with Alzheimer's and dementia. So I'm in this fight for all 3 of those reasons to make a difference.
Wow, Brady, thank you for sharing your story of resilience. And Jonah, it is so inspiring to hear about your passion for dementia advocacy and awareness, as well as your support for caregivers. So Brady, let's delve a little bit more into your story. You are a young man, 31 years old. Can you speak about some of the things you had to learn or perhaps unlearn about stroke during your journey?
Well, I found out that you didn't have to be in your 60s to have a stroke. And I think that's one of the biggest false tales, is that people post 60 get strokes. And they're the only ones that have strokes, because that's what I thought. And I could not understand how I could have a stroke at 31 years old. And then with me having aphasia, I was unable to speak. So I had to relearn how to speak and communicate. And I also found when I was in rehab that post-stroke, I'm more apt to have dementia post-stroke. And so there was a lot of things that the eating. I thought, since I ran marathons, you know, I ran about 60 miles a week. So I thought I could eat anything. And that, I think, also growing up around women, I grew up around 22 African-American women, including my mother and 2 sisters. And so their thought was, you know, you run all the time. You can eat chitlins. You can go ahead and eat ham hocks because you run all the time and you're in shape. But I did not know that there are other things that I needed to do. I needed to change my eating. I needed to change my stress. I needed to take that down. And one of the biggest things I speak about now is falling in love with yourself. If you spend time loving you through exercise, through correct eating, through just getting the opportunity to take a breath, that makes you stronger every day.
And those are some of the steps you took to live a more health conscious lifestyle after your episode, to have different kinds of eating, making different stress choices, that kind of thing.
Correct. Eating now, everybody, I'm the only natural bodybuilder in the United States, well, in the world, that competes with everybody else that's 50% disabled. And last year I won 7 times. And one of the things that I tell people feel that I'm eating right just because I'm a bodybuilder to stand on stage and pose. But I tell them I'm eating for my life. I sit down sometimes by myself, take deep breaths for my life. I'm not doing it to look pretty. That comes on lifting weights. I'm on the treadmill, but I had to fall in love with myself. And now I work out 3 hours a day, 6 days a week, and I eat clean. I don't drink any sodas, anything of that sort.
Well, Cindy, if I can say something to that. I want to applaud Brady and Jonah for being so transparent. But I just had to comment to what Brady just said. When I talk to my patients, and he and I have not discussed this, when I talk to my patients, I say, well, what after having a stroke, you have to give yourself a little TLC. I used to say that all the time. TLC, not just the tender loving care, but also a total lifestyle change. So that's the other TLC. And so I love it. You did both of those things. And that's what I always say. So I really appreciate that. Again, very compelling story.
And then Dr. Benson, you talked about normal blood pressure. You gave us some numbers, and the chart showed in red what is considered high. So for our viewers, can you explain why it's important for people with high blood pressure or hypertension to monitor their numbers regularly, but everybody to monitor your numbers regularly, how often you would recommend, and how to do that at home?
That's a great point. Let me answer that this way. It's known that African Americans have a higher rates of high blood pressure, and it's not known why that is. I've heard several theories as to why that could be, and one of them is related to a selection that could have potentially taken place during the diaspora when African people were being brought from the west coast of Africa over to Western countries like the US and the Caribbean. They weren't able to drink water, and a lot of them became dehydrated. And so in order to not become dehydrated, you had to retain water. Sodium is one of the minerals that causes you to retain water. And so African Americans tend to be very salt sensitive. And if you're eating foods that are very salty, that can raise your blood pressure. And so that's possibly one of the reasons why so many African Americans have uncontrolled high blood pressure. So it's very important to get the blood pressure under control. You should check if you have been diagnosed with high blood pressure, you should monitor it at least once a month. If it's staying high, then you should check it at least every 2 weeks, particularly if you're just been started on medication, or if you're trying to lower it with diet or exercise. Your blood pressure should be checked every time you go to see your medical provider. If you go to your medical provider, it's checked and it's normal, then you don't have to worry about it. But if it's elevated, it falls into that elevated range that we've talked about, then it is important for you to get yourself a home blood pressure monitor. You can get them in any pharmacy. A lot of them are automated. You just sit down at a table and put the cuff on your forearm, and then you on your arm, and then you check your blood pressure. And so if it's still elevated, you can do it every 2 weeks, and then take those numbers, write them down. We have materials on our website, the Mind Your Risk website, where you can write that down, and then take it to your medical provider and show it to them so you can get it under control.
Track that in the app on your phone, and give us the normal top number and the normal bottom number.
So the normal systolic, or the top number, it should be less than 120. And that's the pressure in your system when your heart is contracting. And the bottom number, or the diastolic number, should be less than 80. And so those are the normal numbers. If you're between 120 to 129 or 80 to 90, then your blood pressure is elevated and you should monitor it and do things that you can to modify it. If it's higher than that and it stays in that higher range, greater than 130 over 90, then you should have a conversation with your medical provider.
And one last thing about people like Brady who are active, who believe that they're eating well, who are taking other steps for health in their lives, and it's still not enough. What specific tools or resources will you recommend for people who may not even realize their risk?
What I would say to Brady, and again, that's just a very compelling story. And what I would say is that the fact that you were very physically active before that happened, that probably saved you. As your doctors mentioned, you had been going around for 3 months with the bleeding taking place in your brain, and they didn't know why